Heart supplements. I need you to understand that supplements are supportive tools. Supplements are not primary treatment. At the end of the day, incorporating supplements into our lifestyle helps a lot. The benefits are very great. Let's take the time and talk about 4 heart supplements. It is very important. Number 1 is the omega-3 fatty acids. That is the EPA, the DHA. Now remember, omega-3s are fats that directly affect our lipid metabolism in our liver. Now they reduce something called the VLDL production. This leads to helping with lowering our triglyceride levels. Now they also decrease something called the vascular inflammation. They also reduce platelet aggregation. Now this combination supports something called the endothelial health and lowers something also called the thrombotic tendency. Now, I want you to understand that omega-3 fatty acids helps with patients who have elevated triglyceride levels. Also, patients who have higher cardiovascular risk. Now, consistency, dosing, these are very important when you're taking omega-3 fatty acids. Number 2 is the coenzyme Q10. Now, remember, coenzyme Q10 is essential for mitochondrial energy production within our cardiac muscle cells. Now, remember, the heart relies heavily on something called the ATP. So, reduced coenzyme Q10 can worsen fatigue and cardiac efficiency. It is very important. Now, in heart failure patients, supplementation may improve functional capacity and symptoms. Now, coenzyme Q10 levels may be reduced with statin use due to shared metabolic pathways. Now, personally, I describe coenzyme Q10 as helping the heart work more efficiently, not as a disease-modifying therapy. Now, number 3 is the magnesium. Remember, magnesium plays a critical role in cardiac electrical stability. It plays a critical role in vascular tone. Deficiency is associated with arrhythmias, palpitation, elevated blood pressure. It is very important. Now, magnesium acts as a physiologic calcium antagonist, promoting something called the smooth muscle relaxation. Supplementation is most effective in patients with documented or suspected deficiency. Now, renal function is very important when you're using magnesium. Another name for renal is kidney. So the kidney functions are very important. Now, kidney functions must always be assessed due to the risk of magnesium accumulation. Now, number 4 is the folic acid or vitamin B9. Remember, the cardiovascular relevance of folic acid lies in something called the homocysteine metabolism. Elevated homocysteine contribute to something called endothelial injury, definitely increased stroke risk. So folic acid lowers the